Okay, let's say you've done everything right, and you've done your warm-up, you've done your cool down, you prepared your back, and you still end up doing something to your back. It happens. I've done it before too. You're right in the middle of something, you bend over and there it goes. What do you do now? Well, the first thing you need to do is don't sit down. You got to keep moving. As soon as you start to sit down for any length of time, that pain will increase, and it'll increase quickly. When we talk about next steps, we need to talk about what's called a directional preference. Now, a directional preference means your back is going to have a direction that it prefers to go. It'll make it feel better, and it'll have a direction it does not want to go. It'll make it feel worse. Most of the time, a directional preference will be extension biased. Most of the time when you hurt your back, it's going to be doing something bent forward. It's going to be doing something flexed, whether it's squatting, bending over to pick up your rake, picking up a heavy weight, whatever it is, it's usually a flexion motion that's going to injure your back. In that case, most of the time, extension is going to be the position it prefers to do. Now, there's some things to consider when it comes to back pain. First of all, you need to make sure it's just regular back pain. So what I mean by that is there's certain indications that are going to tell you right away, hey, we're not going to try to self-treat this. We need to get some help, and we need to get some help fast. For instance, if you start losing control of your bowel or your bladder or your legs gone completely numb and you can't walk, that's not the time to try to self-treat this. You need to get to the emergency room, and you're going to need to get some help, most likely. Doesn't mean surgery, but it does mean you're probably going to need some medicines to get you through this. You're going to have to let the physicians decide on that. There are times when your back might not start hurting right away after the exercise, but you can still correlate it back to the exercise, and that's fine. We don't worry about that. What we do worry about is you haven't been doing anything, and then your back starts to hurt, and you can't really figure out why, and the pain's severe. So that might be a case where you also might need to talk to your physician about other issues. You could have a kidney infection, a bladder infection. You might even have, there's cases of tumors and cancers and things like that that can occur spontaneously. That pain just starts to form, and you don't know why. That does not happen very often. It's very unlikely. Most cases of back pain are called mechanical, meaning you've done something and it's affected the ligaments, the joints, the disc, the muscles, something that you've done that's affected that back and is causing the pain, and it's not related to something serious like a tumor or an infection or something like that. The first thing I would recommend as a resource is by Robin McKenzie. He's recently passed, but his research on back pain and self-treating back pain really is probably the best out there that I've found. It's very easy to read. These books don't cost very much. You can order them online, somewhere around $10 typically, and they just walk you through what to do in the case of back pain. And again, it'll talk to you about directional preference and how to determine what you need to do next. So for our cases, and for this course, we're really going to look at extension-biased motion. Most of the time, it's going to be an extension-biased motion that you're going to want to get to right away if you're experiencing back pain. So for example, you've been exercising, running, weightlifting, crossfitting, and your back starts to hurt and you're not sure what to do. We've talked about keep moving, and as part of that moving, we want you to get down onto your stomach as easy as you can and start doing press-ups. And we'll demonstrate those press-ups again in a second, but the idea behind it is to get the back arching. Now, the rule of thumb when it comes to back pain is if the pain is in your back, or even if it starts to travel down the leg, we call that peripheralization, meaning it's starting to peripheralize down to the extremity. That means it's getting worse. Sometimes the pain will actually improve in the back, but it gets worse and worse and worse down the leg. Again, that means it's worsening. So when you're doing an exercise or an activity and it's starting to make that pain go further and further down your leg, that means stop, okay? That's a red light, and it's telling you whatever you're doing, you're making it worse. A yellow light or a green light would be that you're doing the exercise, the press-ups, whatever it might be, and the pain starts to centralize. It starts to work its way back up the leg. Now, sometimes when that happens, the pain will actually increase in your back. That's okay. That's just a precaution. A yellow light but it usually means you're doing the right thing. As long as it's coming up out of the leg, out of the buttock, and into the spine in more of a focalized area, you know you're on the right track and you want to keep going in that direction. So immediately keep moving, get on your belly, start doing press-ups, which we'll demonstrate next. Okay, so you've tweaked your back. What do we do next? First thing we're going to start with is press-ups. Again, we're assuming you're going to have a directional preference that's extension biased. Remember the rule. If we're doing an exercise and it starts to go down your leg, you're going to stop the exercise. No questions asked. You just stop the exercise. It's going the wrong direction. If, for instance, you hurt your back and it's already gone down your leg a little bit and you start to do it and it starts to migrate back into the back, even if it hurts more, keep going. You're going the right direction. So the first exercise, the go-to exercise, is the press-up. You notice his hands are by his side like he's going to do a push-up. He's going to push himself up, arching his back. It's going to hurt. That's okay. Once he gets to the top, he goes as high as he can go, exhales, and try to let that back sag a little bit more. Don't let your glutes activate. Try to keep the legs relaxed. You go back and forth. Now the next question is how many times? It depends on how your back feels. It's going to hurt, most likely. That's okay. Is your range of motion improving? Are you coming up further? Is the pain centralizing? If the answer to any of those questions are yes, you keep going. It might be 10 reps, it might be 20, it might be 50. Your arms might give way before your back says it's had enough. You keep going as much as you can. When the pain stops and stops changing, and it doesn't feel like the press-ups are doing much more, that's when you stop. I would say on average, it's around 20 repetitions, but I know personally, I've done as many as 50. So you have to let your back be the judge on what to do next. So you keep doing the press-ups. A lot of times, depending on the severity, okay, that's good. Now, depending on the severity, I might not want to do much in the way of other exercise at this point. If it's not so bad, I've found that if I can activate those multifidus muscles just a little bit, it actually feels better. So the first thing I might try is in this position, you're going to try to raise one leg at a time. And you only raise it about an inch, right to there. So you don't want to cause a lot of motion in the spine. You just want those muscles to turn on, and then you'll do the other side. If that causes too much pain, that's okay. Don't do it. If it's not hurting too much, keep going. Again, 10, 15, 20 reps. Try to get that muscle to turn on. If it's too much pain, you can try not raising your legs, but just put your arms out straight. So your arm is out straight, and you're just going to raise one arm at a time. Make sure you have your thumbs up and out in that 45-degree angle, and just raise one arm at a time. You'll still activate those muscles, though not quite as hard. And again, you go by what you feel. If it starts to hurt too much, you're done. Go back to the press-ups. And when you have had enough of the press-ups and you're ready to get up, just get up nice and easy, really trying not to bend forward. So you might need to take a hold of a pole, a chair, something like that to help you sit and then stand back up. But just go nice and easy, try not to bend forward. That's the hard thing. Now, if you're at home, all these exercises can be done on your bed. They don't have to be done on the ground or the floor. It just depends on what environment you're in.